Good evening, everyone. I would like to welcome you to our undergraduate webinar of Faculty of Health Sciences at American University of Beirut. This is a great opportunity that we are all gathering here to discover more about our exciting majors at the faculty. So today we are going to get to know these majors, and the most exciting part is that you're going to listen to these majors from the expert at the field, and we are all honored to be with them here. I'm going to start to introduce them one by one, and then we will get to know the agenda of our meeting today. Today we have Dr. Iman Nouaihid, Professor and Dean of the Faculty of Health Sciences. Welcome, Dr. Iman. And we have Dr. Nada Milham, Chairperson of the Medical Laboratory Sciences Program. Also, I would like to welcome you, Dr. Nada Milham. We also have Dr. Sharbel Saadeh, Coordinator of the Medical Imaging Sciences Program. Welcome, Dr. Sharbel. We have Dr. Kim Abu Shaqra, Coordinator of the Medical Audiology Sciences Program. Welcome, Dr. Kim. We have Dr. Rima Habib, Chairperson of the Environmental Health Department. Welcome, Dr. Rima. And we have Dr. Marcoh Bartos, Assistant Professor in the Health Promotion and Community Health Department. I would like to also welcome you, Dr. Marcoh. And finally, we have from Admission Office, Mr. Khaldoon Qaisi. I would like to welcome you all today in this webinar. The agenda of our meeting today is as following. We will see a couple of testimonials from our students, message from heart, the heart of our students who graduated from these programs. Then we will have the welcoming message from Faculty of Health Sciences, our Dean, Dr. Iman Nouaihid. Then we will talk about the health professions, and then environmental health, then health communication, and admission information. Before we actually start our information session, we'd like to share with you these majors that are going to be introduced today through our students' eyes. We have Ali Ayub, who graduated from Environmental Health Department. He says, "What attracted me in the Environmental Health program is the diversity of its subjects. Being equipped with the skills and knowledge gained at FHS and the ambition to pursue the career that you love makes the challenging environment feels like an enjoyable ride." Another testimonial from Bassam Al-Hafi. He is a medical laboratory science graduate. He says, AUB's education is not restricted to textbooks. You meet new people. You start seeing things from a different perspective. You get the luxury of choice after completing your undergraduate studies in medical laboratory sciences, and whatever you choose, you would be confident in. Another testimonial from Dania Turjman from Environmental Health Department as well. My advice is to always seek opportunities. Join volunteering work and love what you are doing. You are adopting a cause for life, and you will only succeed if you have a true passion and love for making this world a better place to live in. No matter how small it is, make a positive change. Another testimonial from Ramez Kouzi, a medical laboratory science student graduate. Being part of FHS will change you forever. You get introduced to a new family that will always push you to be a better student, person, and citizen. This major will open a lot of doors for students, whether make them ready to join the workforce or for postgraduate studies. And we have also testimonial of Noor El-Hidik. She is a medical audiology sciences. One thing I like about audiology is that it is a very diverse and flexible field. You can choose to work with pediatrics, hearing aids users, dizzy patients, and many others. Audiologists can be in various places like schools, hospitals, clinics, and even cochlear implant surgeries. And finally, we have Noor Aridi, another medical audiology student. She says, every day brought a new case, a new story, and a new opportunity to help. It's the baby reacting to his mom's voice for the first time, the sincere thank you from an old man, or the high five from a little kid that made my day. So these were the testimonials of our graduates in the Faculty of Health Sciences. Today we are mainly going to focus on 5 programs, as you can see them on this slideshow. So first one will be Medical Laboratory Sciences. Then we have Medical Imaging Sciences. Then we have Medical Audiology Sciences, Environmental Health, and finally our newest program, Health Communication. To start with, this is the agenda of our meeting. We have the honor to start this meeting with the Dean of the Faculty, Dr. Iman Nouaihid, who is going to welcome everyone here. Dr. Iman Nouaihid, the floor is yours.
Hi and good evening. My colleagues will talk to you about the specific academic programs we offer at the Faculty of Health Sciences. My message to you is rather simple. I have 2 points to share with you. First one, you will be making the right decision to join an undergraduate academic program in health, be it in environmental health or health communication. Both address the health of people and their physical and social environment. Or joining one of our 3 health professions programs, which address the health of individuals, taking into consideration their physical and social environment. So why is this the right decision to join a health major? Because the health needs of people, be it at the level of the community or the individual, they are on the rise, and both the healthcare system and the public health system, including environmental health and environmental management, they are expanding. So rest assured, by the time you graduate, there is a place for you. My second point, you will be making the right decision if you join the Faculty of Health Sciences at AUB. And why is that? Again, because, as you heard from the testimonials, in addition to the excellent learning and training you will receive, you will be joining one of the most committed and engaged schools at AUB. We see our students as our future ambassadors to the world and as agents of change. We see you as potential advocates, leaders, concerned citizens, believers in change, and we help you to get there. We help you to get there through our academic programs and also through activities outside the classroom. This is a faculty where you will make friends quickly, and this is a faculty where you will have close advising and mentorship from the professors. To give you an example, last week AUB launched its first Giving Day, where alumni from all over AUB, faculties and schools, all alumni were encouraged to give back to their faculties. Our Faculty of Health Sciences won the first place in the proportion of alumni who gave back. Our alumni are doing very well. And actually giving back, this says a lot about what FHS and what their experience at FHS still means to them. They're occupying leading positions and they're doing very well in their professional life. Although some of them have graduated years ago, they are still connected to this school and to their professors. So I'd like to close by encouraging you to consider an education in health. And also, I encourage you, and I would love to see you joining the Faculty of Health Sciences.
Thank you very much, Dr. Nouaihid, for this warm welcoming. Now we can start our information session, and we will be starting with the health promotion, with the health profession division, and specifically the Medical Laboratory Sciences. So the floor is yours, Dr. Nada Melhem.
Good evening again, everybody, and on behalf of the Division of Health Professions, which is the home of 3 programs, Medical Laboratory Sciences, Medical Imaging Sciences, as well as Medical Audiology Sciences, I'll be saying a few words about the Medical Lab Sciences. So before I start, I'm a proud graduate of this program, and I feel fit to talk about it and to promote it to all of you. The graduates of the Medical Lab Sciences are going to be highly skilled professionals that are able to perform laboratory testing in order to be able to detect, diagnose, and eventually help in the treatment of human diseases. I would like to let you know that a degree in medical laboratory sciences will actually guarantee you immediate career opportunities. Let it be in private laboratories, public laboratories, as well as research careers, in addition to pharmaceutical companies. You would be able as well to join and apply to schools of medicine to pursue graduate studies in basic sciences or Master of Public Health. I would like to promise you skills that you will develop based on upon leaving our program, and these do not include technical literacy only, but they include as well multicultural awareness, they include research skills, and they include organizational skills. And these will definitely distinguish our students in a highly competitive job market. And this is why I invite you to join us and to learn and to visit the Medical Lab Sciences and to learn more about it and about life at the Faculty of Health Sciences and at AUB.
Thank you very much, Dr. Nada Milham. So now that we know about medical laboratory sciences, it's time we get to know more about X-rays. Now, we are all familiar with X-rays, but to know more about the medical imaging field, let's yield the floor now to Dr. Charbel Saadeh.
Thank you very much, and good evening. At one point in your life, you will know someone that you love very much, or even yourself who's had a chest X-ray, a CT scan, or MRI. Medical imaging uses X-rays, which looks deep into the human body. It allows us to detect cancers. It allows us to see bone fractures. It allows us to look for blood clots, and also it allows us to see soft tissue injuries or injuries due to sports. The technology that we're using today is ever advancing very, very fast. We are at the forefront of these achievements. We are also known to be the eyes of medicine, and we keep those with us, around us, a lot longer. The MIS program uses teaching techniques in anatomy and pathology, which is the most advanced in the world. We have just purchased a state-of-the-art or world-leading technology that looks at the human body in digital format. We are the first in Lebanon. We are the 50th in the region. However, in medical imaging sciences, we are the first in the world to take that next leap in technology. We are investing in your knowledge. We need leaders and we need knowledgeable students who are going to take care of our loved ones. Our program is unique. We work very closely with the Faculty of Medicine in the hospital at AUB MC. So we translate what we teach you in the classroom into the clinical environment. You will have access to the world-leading technology, and you will be working with patients on day-to-day. So as you can see in the video, you can actually see me looking at the images, trying to find a lesion in the brain. Also next to me, you will see the laptop, where it has the digital lectures that we're given to our students in our class. We have now become digitized. We are now advancing the way we're looking at imaging. We are now performing leading research in the field. So this course also prepares you for further degrees. If you want to continue into medicine, it provides a strong foundation for you. You're able now to be the leader in medicine by being able to diagnose, visualize anatomy, that your students around you don't have the opportunity. Being a leader in medicine has great impact. The question is, do you want to lead? We need students like you to take care of our loved ones. There are many job opportunities out there in medical imaging, such as academia, the clinical environment, as well as industry. You have such a wide array of opportunities to grow, from the chief radiographer in a department to a CEO of a big corporate organization. So we welcome you to be the next leader. Start small, think big, and create change. Thank you.
Thank you very much, Dr. Charbel Saadeh. So far, we covered medical laboratory sciences, and then we talked about medical imaging sciences. Now we are going to know about another interesting major at our faculty, which is medical audiology sciences. And this interesting major is actually one of the newest in the Middle East. And let us all welcome and give the floor to Dr. Kim Abu Shaqra, who's going to explain about medical audiology sciences. Dr. Kim Abu Shaqra, welcome.
Thank you. Hello and welcome. Let me introduce our program by answering the following question. What is an audiologist? Well, an audiologist is a professional who provides health care to people who have hearing or balance disorders. We work with people of all ages, from birth to the elderly. As an audiologist, you can expect a diverse workday. So, for example, you may begin at your day with testing babies in the nursery to identify hearing loss within hours of the baby's birth. Then, throughout the day, you will use sophisticated equipment to first diagnose the problem, then to interpret the results to the families, and then to provide an intervention plan. Then, if, for example, if your patient has a hearing loss, you would be the one who would select the most appropriate hearing aids. Another example, if your patient has balance disorders, you would be the one to set a treatment plan to prevent people from falling. So later in the day, you might find yourself in the operating room where you're going to be monitoring patients during surgery or evaluating an implantable hearing device. You may end your day following up on emails or phone calls where your expertise is needed. For example, you might provide guidance to teachers on how to work with hearing impaired children in a classroom setting. You might be following up with a speech therapist to see how your patients how their speech and language is developing. You also might work with industrial managers where you want to help them devise a conservation plan to protect their workers from noisy environments. In terms of the field, our program is the only audiology program in Lebanon. Students will learn their theory in classroom by classroom lectures, and then they have a unique opportunity to apply their skills in a clinical setting in our brand new state-of-the-art facilities at the AUB Medical Center. The MAS program does have a pre-medical tract for students who are interested in pursuing a career in medicine. And as an undergraduate with a background in audiology, this will be very, very beneficial because this will not only give you exposure to a hospital setting, but it will also give you a lot of interactions with patients from the very beginning of the program. Since audiology is new to Lebanon, certified audiologists are greatly needed throughout the country as well as the Arab region. So therefore, employment opportunities for a typical audiologist holding a bachelor's degree can range from working in your own private practice to working in a hospital setting, in research laboratories, and at universities, as well as working for international companies who are involved in hearing healthcare. If you want more information, please don't hesitate to contact us. We can provide you with tours of the facilities and more further information. Thank you.
Thank you very much, Dr. Kim Abu Shaqra, introducing the medical audiology sciences. Now, from the health professions, we move into other fields that touch our daily life. Since life is all about the relation between us and our environment, let us also hear another program at our faculty, which is Environmental Health Program. Leading this session will be Dr. Rima Habib. Welcome, Dr. Rima.
Thank you, and welcome again, and it's a pleasure to be here with you today. Environment. We've been hearing a lot about this term. Do you know the importance of having a good and clean environment? Living and working in a safe surrounding, breathing fresh air, drinking clean water, and eating safe food are all environmental aspects that are essential for maintaining health and well-being. When we decide to overlook the importance of protecting the environment, we face major public health problems. The most vivid examples that we have been witnessing recently is the pollution of our water resources, the pollution of the air we breathe, and most recently, the solid waste crisis that led to the accumulation of the wastes on our streets. These are few examples in the Lebanese context. Globally, the world faces serious environmental problems that have detrimental impacts on health. Global warming is one of the examples. To deal with these issues in Lebanon and abroad, we need environmental health experts. The job market is open to these experts. For example, they conduct environmental impact and risk assessments for all types of development projects, as small as local industrial plant to as large as an international airport. The Environmental Health Bachelor of Science program at AUB is a program that makes a difference. I am a proud graduate of this program before I acquired my master's and PhD. This degree will give you a chance to be part of something big, of a global effort to improve the world we live in. It is not just a career choice or path. It's about developing a way of thinking, a way of living, and acquiring experience in a field to help make the world a better place. Do you want to be part of this exciting experience? Then join us now to shape a better and healthier tomorrow. Thank you.
Thank you very much, Dr. Rima Habib, explaining the environmental health program at our faculty. Now, last but not least, we are excited about our newest program at Faculty of Health Sciences, the first and only of its kind in the region, the Health Communication program. So now let's give the floor to Dr. Marcoh Bartos. The floor is yours, Dr. Marcoh.
Thank you very much, and it's my honor and pleasure to present you the Bachelor of Arts in Health Communication. But let's start from the question, what is health communication? So health communication, it's the art and science of communicating health information, like in public health campaigns, and the communication between doctors and patients, which is very important for reasons that you might imagine. So for example, what can you say to convince someone to stop smoking, or to stop littering, or to eat better? So how would you communicate lab results or CT scan in a way that doesn't threaten the patient? So in the background, you'll see soon some examples of campaigns that have been developed in Lebanon in the last few years. In this program, so you will learn that it's not only what you say, but how you communicate health content that matters. So there are three main points I want to mention here. The first one is the program is very new. It's the only one actually of its kind in the Arab world and in the region. The second point is that the program is unique because it allows you to design print and digital media content like videos, press releases, even websites for various types of audiences. The content, of course, is related to health-related issues. At the same time, it's offered to any background, so it's a Bachelor of Arts, so any student from any scientific and non-scientific background can undertake this course. And the program is also needed because it responds to a market that is requiring health professionals specialized in communication to answer very important needs. There are many organizations where you can work on. International organizations like the WHO, the World Health Organization, the UNDP, UNICEF programs, governmental agencies, ministries of public health, social affairs, education, environment also. There are also a lot of civil society organizations, advertising and marketing agencies that are specialized on health and health promotion. Also news media, because we need health journalists that are able to communicate health-related topics in a more efficient and effective way. As well as, of course, we have hospitals and universities like AUB. So we are in desperate need of new professionals in this domain. So to conclude, if you care about the health and the environment, if you want to make a tangible impact in Lebanon, in the region, and if you're interested in media and communication, then the health communication program is here for you. So become a change maker and join our program. Thank you very much.
Thank you, Dr. Marcoh. Now that we covered all the programs at our faculty, we also have with us Mr. Khaldoun Qaisi, who's going to give us a quick insight about the application process that will take step by step through AUB. So the floor is yours, Mr. Khaldoun Qaisi. Welcome.
Good evening and welcome to this webinar. In regards to admission to AUB, at AUB we rather have a competitive-based admission, where 50% of your acceptance is based on your SAT scores, and the other 50% is based on your school grades of grades 10 and 11. In regards to deadlines, our admission deadline is every December of every year, and we send out the acceptances later on every April. Regarding financial aid, AUB, of course, does offer financial aid. We offer up to 65%, dependent on the need and social status of the family. Also, we have scholarships, various scholarships for the students I would like to talk about. We have the Merit Scholarship, the Lebanese Baccalaureate Merit Scholarship, the USAID Liberal Arts Program, the MasterCard Foundation, the MEPI Program, Al Ghurair STEM Scholars Program, the Nursing Program, and of course, last but not least, the Advanced Student Scholarship Initiative. Thank you very much.
Thank you very much, Mr. Khaldoon Qaisi from Admission Office. Thank you, everyone. Now that we are live, all you students, you all have the opportunity to ask questions. People are following us from the webinar and also Facebook Live. We are receiving a couple of questions, so please be patient. We will try to make sure that we answer as much question as possible. Now, the first question that we received, this is regarding the medical imaging. And Ahmed says, in terms of practicality and theory in medical imaging sciences, what is the weight of these practicality? Are there any practical courses? Mr. Sharbil Saadi, can you please answer to this question?
Thank you very much, Ahmad, for an excellent question. So whilst our program is 60% academic, the other 40% you'll be working in the state-of-the-art hospital here at AUBMC. So every day of your entire program at AUB, you will be in our hospital at AUBMC. So you will be in different areas, talking to patients. We will teach you how to cannulate patients. You will actually sit behind a CT scanner or take an X-ray of these patients, and you'll be able to perform and produce excellent image quality and images to help save those patients. So 40% of your entire program or life here at FHS and AUB, you will be at AUBMC working with real-life patients every single day.
Thank you very much. Fair enough and to the point. We will have another question from Maya, and I think this question is about the technologies. Okay, so Maya says, you said that I will learn and use new media technologies in this program. Do you also mean by social media, Facebook? What do you mean by multimedia tools and software in this program? Dr. Marcoh Bartos, please.
Yeah, I wanted to pinpoint this thing. Yeah, you will learn to use digital media and digital technologies to communicate health content, health-related content. We have a program that is shared also with the media studies, so we'll have also some digital skills and media and law that is very important in order to communicate health-related content online. Because we are, of course, we are in a digital world, so we need to be able to communicate content in this channel. So I hope I answered the question.
Okay, brief enough. Thank you, Dr. Marcoh. We also have Pankaj from India, who's actually this is kind of a question, and I think it's about environmental. Tell us about environmental and occupation health. So can you please tell us about this, Dr. Rima Habib?
Environmental health is, the Bachelor in Environmental Health prepares you to deal with the issues that I told you about earlier, which are the water resources, air pollution, and all the general environmental areas. Occupational health is specifically concerned about the environment of workers and making sure that workers' environment is safe and healthy to maintain the health of the workers. I can elaborate further if you have more specific questions for me later.
Okay, great. Now we have, okay, so Pankaj was just asking Dr. Rima that if you have also a PhD program?
Currently, we do not have a PhD program, but we are thinking about, we already have a PhD program in the faculty, but that's focused on epidemiology. So there is a PhD in epidemiology. It can be a PhD in environmental epidemiology, for instance, if the thesis is focused on this.
Okay, great. We have another question from Hassan. Hassan says, can undergraduate of medical laboratory sciences, MLS, continue masters in environmental health? I think Dr. Nada Malham can take that question.
Well, a holder of a BS degree in medical lab sciences can actually pursue any master's degree or graduate studies, let it be scientific or non-scientific, as long as they have the prerequisites. I will hand in this question to Dr. Habib in order to tell us whether there's a load actually of courses that could be needed in order to do so.
Okay.
Actually, no. It's many students who have studied medical lab sciences have pursued an MPH or a Masters of Science in Environmental Health. So it's a straightforward process, and it doesn't need it's not complicated at all. So it can be done easily.
Okay, okay. We have another question from Dima Sharara. She says, what is different at your faculty? Can I find a job? So I think we can direct this question to Dr. Nuwayhid, probably. What is different at your faculty? Can I find a job?
Yeah, these are two questions, so thanks for both of them. One, what's different about the faculty is the fact that you have the chance of engaging with really a very active faculty and student body. And the school is very well connected within the AUB community, and also we have a lot of activities outside the AUB walls. So you're going to have a lot of interesting experiences, not only limited to the classroom, but also outside the classroom. Will you find a job? Definitely, and there's no doubt about that. And as you've heard from the different speakers, the opportunities are many. You could be in a hospital setting, in a research setting, in an NGO, non-governmental agency, in a community setting. You could be in also working in governmental settings. You could be working with international organizations. You could be working with patients. You could be working with communities. So the opportunities are many. And what's also very important, that you can pursue any graduate program of your liking. I don't think you should worry. You just go ahead. If you like any of the programs, don't worry about your future career. It's almost guaranteed.
Okay, thank you, Dr. Nuwayhid. We have another question from Hannah Deep. It's about medical audiology. She says, I read that your program started in 2015. Do you know where are your graduates now? Where are they working? I think this question would go to Dr. Kim Abu Sha'ra. So where are your graduates? Yes.
Thank you very much for the question. Currently, all of our graduates can be divided into three main areas. 60% of our graduates have decided to continue on with graduate studies, whether it be master's degree in audiology or a doctoral degree in audiology. They are at universities in the United States, in Europe, as well as Australia. 30% of our graduates currently work in private practice, clinics, as well as hospital settings. And about 10% of our graduates are in a academic setting, working in related to audiology in teaching or training in clinical practices. Thank you.
Thank you, Dr. Abu Sha'ra. We have Asil asking a question also. How many years does medical imaging take? Medical imaging. Dr. Sharbil.
So thank you, Asil, for an excellent question. So medical imaging takes 3 years, and throughout these 3 years, when you leave us to go into your working life, you will be ready to go and well equipped, both academically and clinically, to start imaging your patients. Thank you.
Thank you, Sharbil. Brief enough and to the point. I just wanted to tell our audience that be patient. We will try to tackle all the questions one by one, and we have plenty of time. I know this is a great opportunity. You're listening to getting the answers from the expert in the field, from the professors themselves. We have another question from Ali. He says, what is the cost of credit per semester? And I think we can direct this question from the admission office, Mr. Khaldoon Qaisi. What is the cost of the credit per semester?
Okay, thank you, Ali, for your question. The cost of credit per semester is $790. However, the student can, of course, take up to 18 credits per semester, but he will be paying for 15, which will cost around $12,000. And of course, when they apply for financial aid, this will be deducted also from their total tuition fee. Thank you.
Thank you, Khaldoon. We have Aya asking a question about, does the university offer any practical training or internship in the field of medical lab? Or we have to go and find the internship by ourselves? So medical lab, Dr. Nada?
So the last year during the student stay at the Medical Lab Sciences program is actually spent in the clinical laboratory sections of the American University of Beirut Medical Center. So our students rotated during this last year in different sections, which include disciplines such as microbiology, where our students take a look at bacteria, identify viruses, physiological mechanistics, and immunology, as well as genetics. So you don't have to worry about finding any internship. We actually prepare the whole year for you, and the smooth rotation during your stay at AUBMC.
Thank you very much, Dr. Nada. We have another question. It's very general. It says, can I go into medicine if I come to your faculty? I don't know where can I direct this. Who would like to take this question? Can I go to medicine?
The answer is yes. In all the majors that we have described today, they have a pre-medical track, and they can pursue medicine provided that they fulfill the requirements, of course. But we have a pre-medical track in all the fields that we have talked about today.
If I may add to this point for medicine, is the fact that, as Dr. Habib mentioned, there is a pre-medical track, and the admissions to the School of Medicine have changed. While in the past, the only majors that were allowed into medicine were from biology and sometimes biology and chemistry, now they're open to all majors. So I think the advantage that some of the students will have here, because they're exposed to health issues, they are very well prepared to join the medical school. And in many cases, if they're doing well and the grades are well, they're actually at an advantage.
Thank you very much. We have another question from Ala Arabi. He says, what are the types of settings that I will be working in after graduation in the field of environmental health? So what are the types of settings that I will be working in after graduation? Dr. Rima Habib?
It's a very diverse, thank you for this question. It's an excellent question, actually. Career options are very diverse in the field of environmental health. So our graduates have been working in UN agencies, WHO, UNEP, UNDP, and I'm looking at some of the information that I have here in front of me, in the private sector, in engineering companies, in hospitals, industries, consulting firms, in the public sector as well, ministries, municipalities, and various institutions, in NGOs, both international and national NGOs, of course, in academic and research institution as well, as they get a taste of research while they are preparing for fulfilling the requirements of the degree.
Okay. Thank you very much. We have another question from Asil. So Asil says, what career we can join in medical audiology? The career.
Sorry, thanks. Thank you for the question. So what career? I'm going to assume that this is about what you can do with your degree. Well, in audiology, you could, of course, as I mentioned earlier, you could work in your own private practice in Lebanon and the surrounding areas. You could also work in private clinics. You can work in a hospital setting. You can certainly work in research labs. You can also work in NGOs. You can work in the government looking at preventative care for people with hearing and balance disorders. You can also work in a teaching environment at a university setting, and also with international corporations that are involved in the selling of products related to hearing healthcare. So those are all the different opportunities, and you're certainly prepared to go on to graduate school in other healthcare professions as well.
Thank you very much, Dr. Kim. We have Remy Matar, who's asking regarding the health communication. She says, what is the background needed for me to be successful at this major? health communication, Dr. Marcoh Bartos.
Yes, hello. It's a good question. We think that we need to have a very varied discipline background. However, there's no really prerequisite for this course. So it's a Bachelor of Arts. That's why we don't require any scientific prerequisite. So we're going to take courses in a broad array of disciplines here at the faculty or in the Faculty of Arts and Sciences. So I think there's no worry about that, what background you can have at any.
Okay, thank you, Dr. Marcoh. We have also another question from Hassan. Hassan says, could we see in future representative of the 5 sections collaborating to maintain the health awareness campaign through Lebanon, and we are ready to volunteer? So who can take this and respond to Hassan?
Yeah, I can take that.
Okay.
So that is an absolutely fantastic question. So with medical imaging, even though we're x-raying and we're taking images of people and detecting disease, on a scale within Lebanon and the region, we have collaborated right now with 2 other professors in our faculty. My first collaborator is Dr. Rima Habib, who is also mentoring me. We're looking at the amount of radiation that is received by our patients throughout Lebanon. So if you're going to walk into any radiology practice within Lebanon, are you getting too much or too little radiation dose to get your diagnosis? So this becomes a public health, environmental health initiative. And with this, we're collaborating with another professor, Dr. Fadi, who is then taking this, and we're going to fight for this within government in order to change policy. So then people throughout Lebanon are able to get consistent and safe radiation to the patient without affecting their health. And this is the most important thing, how this is one example we're working on right now, a large initiative which is supported by the Dean and this faculty to make a change to how we're practicing every single day and how we can provide the same quality of care, whether at AUBMC or any other hospital or private practice throughout this country or the region. Thank you.
Thank you very much, Dr. Charbel. We have another question from Remy. She says, in the field of medical lab, other than opening my own lab or working at the university, what is the scope or the future after I graduate from medical laboratory? Dr. Nada Melhem.
So there is one important part of your question is the fact that you assume that you would be able to open a lab of your own. Actually, a medical laboratory scientist is not allowed by law to open his or her own lab. The regulations and the laws in different parts of the Arab world actually would allow only medical doctors with a degree in medical pathology and laboratory medicine to be able to open his or her own lab. In addition to that, there are certain countries whereby a degree in pharmacy would allow the graduate to open the lab. However, in terms of the career options about a graduate with medical lab sciences, so if you are interested in opening your lab, you can start by taking pre-medical courses while you are staying at the medical lab sciences, and then apply to medical school, and then pursue your fellowship and residency in the same program. But you can also go to other fields where you can do PhD degrees, studying different disciplines, more specific disciplines of the medical laboratory sciences. And I hope I answered your question.
Thank you very much, Dr. Nada. We have also Asil asking a quick question. How many years audiology takes? So, Dr. Kim.
Medical audiology is a 3-year program, post your freshman year. So during the first year, you have basic common courses where you'll be meeting and interacting with students from other professions, other programs that have been mentioned here today. At the second and third year, you will be having your theoretical courses and you'll be working in the clinic. So by the time you graduate, you will not only have all your theory, but you will have, if you clump it all together, 6 months of training in the clinic. So you'll be very, very comfortable going out and walking into a clinic and performing all of the tests that you will need to diagnose the patient. So 3 years, we will have you ready to walk in the door and start to work. Thank you.
Okay, great. We have another question from Sharbil. So we have another Sharbil asking a question. Is an internship required in order to graduate from environmental health program? So is an internship required, Dr. Rima Habib?
Yes, in fact, it is a new requirement. It's been recent, fairly recent, 3 years ago. We have introduced a capstone or an internship into the summer of the second year. And this has been very welcomed by the students, and this has been a very good, an excellent opportunity for students to be placed out there in the field. They could be recruited later on in that workplace where they have really practiced and where they have learned about the work they are doing. So we place them in places such as the public sector, the private sector, industries, consulting firms, in academic and research centers, in UN agencies, or even international and national NGOs. So it is a requirement, it is a must, but it is a very, it's conducive for finding a job later on. Thank you.
Okay, thank you. We have a question from Hana Munzer. She says that knowing that the health communication is the first program in the Arab region, what are the potential career options in our region? Or again, we are going to travel and leave this country and find job outside. So it goes to Dr. Marcoh.
Yes, okay. So assuming that you're staying in Lebanon, there are plenty of options, as I mentioned before, from the private to the public sector to the non-profit sector. There are many organizations, small and big, that can offer you an option for a job. If you plan to leave the country and go to work, for example, in the Gulf, there are also many organizations, the Ministries of Public Health, or public and international organizations that they work in health-related fields that can be definitely your choice for work. If you're going to go also for a career, let's say in academia, also in Europe and in the US, United States, there are also many options there. I want to just briefly mention that the health communication as a discipline is born in the United States, as the song says. So there are also many options in overseas there.
Okay, we have a question from Layal. Layal Hamoud says, if I want to study in the medical imaging sciences, should I be good with chemistry or biology? What skill is needed most? So, Dr. Sharbil.
Thank you very much for that question. You know, there are prerequisites that we have before coming to medical imaging. So at school, if you come and you do your biology at school, and then when you come to your first year at university, you will take these courses in biology, and this is a pathway for you to come to us in medical imaging. So usually in your first year at university here at AUB, you'll be doing biology courses, some physics courses, and this is the foundation before becoming great radiographers in the field. Thank you.
Okay, we have a questions from Muhammad Qasim. I don't know who can answer this, but he says, if I'm really good with physics and math, where can I fit in your faculty? So Muhammad is good with physics and math. Where can he fit? Who can take this?
Everywhere, just everywhere. If you're good with physics and math, you can fit everywhere. So you are most welcome.
Okay. We don't have enough time for, we will just take 2 more questions, and We'll make sure that other questions that were raised in the webinar and Facebook Live will be answered later through email or through text to you. We have another question from Layal. She says, does the major I choose require me to work in the same field or industry? She doesn't specify what major she chooses. So again, another open question for anyone who wants to take.
So let me take this question, Layal. It's so again, what's very if I understood your question well, what you have heard from my colleagues here, that whatever program that you join at the faculty allows you actually to pursue any graduate program to a major extent. On one hand, there's a pre-med track in all of these programs. Two, you can join the Masters of Public Health here, and you could even shift your track down the line. So, example, let's say if you're doing medical audiology or medical lab or environmental health, and you decide that you want to focus on health management and health administration and hospital administration, you can actually pursue that and join our MPH program, Masters of Public Health, and do that. So it's quite open, and it allows you, with the wide background of training and exposure, to actually go in different directions, academically and workplace.
Okay, thank you, Dr. Nuwayhed. We have another question from Asil. What is the most required major in Lebanon? And another open question. Who can take this? What is the most required major in Lebanon?
Yeah, allow me, Asil. It's not. That's a very tough question. Frankly, that's a very, very tough question, because I don't think in the country we have an extensive survey of the job opportunities and the careers and all of that. As you know, that many students think that going to engineering, perhaps going to business, is the only path to success and to a good job opportunity. What we're trying to tell you here, that there are many other opportunities, and what you've heard of here from the colleagues is that you can actually do wonders with your life and the impact on your community, on people, patients or healthy people, and have an impact on them. So the question, actually, I sort of turn it back to you, and you need to answer mainly, what is that thing that makes you tick? What's that thing that your heart says, this is what I want to do? And I think that's an important question, and that's why we're showing you and presenting the different programs. It's you and only you who can say, I find myself in this program or the other. And we assure you that when you join, you're going to have a lot of help and support to guide you through that process.
Thank you, Dr. Nuwayhed. We have another question that says, how can I be sure that my major fits me? Can I easily choose them or transfer between those majors at your faculty? Another open question.
So let me, because it applies to all, the fitting thing is again another challenging thing. The university here at AUB, we're thinking seriously about starting developing sort of techniques to help students sort of pick up what is really most suitable for them. You can definitely find online some of these programs that help you sometimes guide you into what is really sort of the most important thing for you. As for transfer, yes, this is possible. So we have students who join a program, and maybe after a semester or two, they find maybe that they like to shift to another program, and that's a possibility. As long as you have good grades, you can move between programs, because the admission criteria is almost standard across all the different programs.
Thank you, Dr. Nuwayhed. Now that we are reaching the end of this webinar, I would like to also give the platform to all the speakers here, that if they missed anything, they want to share it with everyone. So we would like to give everyone 1 minute, and we will end, as we started with the warm welcome of Dr. Nuwayhed, we will also end with his last words and this will be our last meeting. So let's start with Dr. Kim Abu Sha'ra, and if you have anything to say in 1 minute, please. Thank you.
Well, thank you for that, and thank you all for staying with us tonight. I would like to just point out again, the field of audiology is in its infancy in Lebanon. Again, we are the first program in Lebanon and one of only a handful in the region. You can make a major, major impact on people who have hearing loss or who have balance disorders in this area. The sky is the limit. The opportunities are vast, as well as the diversity of the job. You will find it rewarding and very stimulating. So I really encourage you to apply to the program. You will enjoy it immensely. Thank you.
Thank you. Dr. Sharbil?
Let me say this. Lebanon is in trouble at the moment. We have a lot of, issues with politics, with healthcare, and we need good people like you to make that difference. We can't wait for that magic wand to make Lebanon good. It starts with each and every one of us. If you really want to make a difference, if you want to reduce the amount of cancer, if you want to help those patients get detected a lot faster, if you want to stop medical errors, if you want to change and keep those ones around you a lot longer without anyone making mistakes, then your eyes is what is needed for this program and for this nation and for any nation beyond ours. Make your difference and be that change. Thank you.
Thank you, Dr. Sharbil, for this warm message from heart. Now we move to Dr. Nada Milham.
I'm actually going to be brief, so I actually encourage each one of you to contact us in order to schedule a shadowing session or a tour at the Faculty of Health Sciences and at our clinical labs at the American University of Beirut Medical Center, and I assure you, you will not be disappointed. And at the same time, we actually introduce you to our diverse life and dynamic one at the American University of Beirut. So please contact us and we will be happy to guide you and to offer you any type of information.
Thank you, Dr. Nada Milham. Now we move to Dr. Rima Habib.
As we were preparing a brochure to talk about our program, and this brochure was entitled "Be the Expert, Lead the Way, Make the Difference," we were tallying all the jobs, all the career opportunities that our students could be into, and I'm going to read very quickly some of them to tell you how exciting the field of environmental health is. You can be an environmental consultant, an environmental policymaker, an entrepreneur, an auditor, a GIS analyst, a forensic scientist, an investigator, an impact assessment analyst, an educator, a media analyst, a project coordinator, a journalist, and the list goes on and on and on. So this field, the environmental health field, is so diverse, it won't disappoint you because you can move into a very diverse career opportunity and it will pay off. At the end, who doesn't care about the environment? Who doesn't care about a safe surrounding, about the air we breathe, about the food, the safe food that we eat? We all care about this, about the safety of our water resources. So please join. We are waiting for you.
Thank you, Dr. Rima Habib. Indeed, we need all these awareness. And now we move to Dr. Marcoh Bartos.
Yes, I wanted to stress one point, exactly how my colleagues have said. We need your help, and we need the help of many people to solve the big problems that we are facing in Lebanon and in the region, of course. So our programs, I think they bring together expertise from different fields. At the same time, we realize when we are here, of course, we have to try our programs first, that the collaboration, interdisciplinary collaboration between faculty members and between the programs are fundamental to solve the problems you're living in. Talking about air quality or the water pollution and the waste management in this area. So please consider very well these options and come join us. Thank you.
Thank you, Dr. Marcoh. And the last message to Dr. Iman Nouaihid.
Okay, thank you for being with us. And so I will finish with answering one of the questions about the criteria for admission. And I know that the focus has been on grades and has been on questions on what courses and whether it's physics or math and all the others or biology. All of these are part of the requirements. But I think the most important requirement and the most important sort of element of all of this is you and what your heart actually is leading you. And I think what we really need and what we are really excited about are students who are committed, students who are dreamers, students who believe in change, students who believe that they can make that change, students who believe that they can make a difference, and students who did not lose hope, students who feel they are actually our future and they are the hope for the country and for the region. Do not hesitate. Ask questions, check with the colleagues, contact us, look at the website, and join the programs, and you'll be part of a team, a big team, with a big heart, with also a lot of science and evidence behind us, and with one mission is to make our environment and to make the health of people that we care about better and better. So thank you for being with us.
Thank you very much, Dr. Nuwayhid, for this touching message. And at the end, I would like to tell our students, people who are following us on the webinar or Facebook Live, you can reach us through Instagram, Twitter, Facebook by searching for FHS_AUB. People who are following us through webinar, you will get all the brochures needed, and we can send you there. And the question that were raised, we'll try to answer them as soon as possible. And also people who are following us on Facebook. I wish everyone best of luck, especially our dear students who are looking for a bright future. Thank you very much, and see you in another webinar hopefully soon with Faculty of Health Sciences.